Sex is a topic surrounded by myths, misconceptions, and misunderstandings. For generations, people have passed down stories, rumors, and half-truths about sex, often leaving others confused or misinformed. Today, it's more important than ever to separate fact from fiction, especially as information is so widely available and not always accurate. Let's take a closer look at some of the most common myths about sex and uncover the facts that everyone should know. One of the most persistent myths is that talking openly about sex encourages risky behavior. Many people believe that if parents, teachers, or society at large discuss sex, it will lead to increased sexual activity among young people. However, research consistently shows the opposite. Open, honest conversations about sex, relationships, and consent are linked to safer sexual behaviors, delayed first sexual experiences, and reduced rates of sexually transmitted infections and unplanned pregnancies. When people have accurate information and feel comfortable discussing sex, they are far more likely to make responsible choices. Another widespread misconception is that sex should always be spontaneous and passionate, just like it appears in movies or on television. In reality, real-life intimacy is rarely perfect or effortless. Many couples find that planning or scheduling intimate moments is not only normal but helpful, especially in long-term relationships. Life can be busy, and making time for connection can strengthen relationships. There's nothing wrong with discussing desires, boundaries, or even specific plans for intimacy. The idea that sex must be spontaneous or it isn't real is a myth that can put unnecessary pressure on individuals and couples alike. A common myth is that men always want more sex than women. This stereotype is reinforced by popular culture, but the truth is far more nuanced. Desire varies greatly from person to person, regardless of gender. Factors like stress, health, relationship satisfaction, and hormonal changes all influence libido. Some women may have higher sex drives than their male partners, and vice versa. The key is understanding that there's no one-size-fits-all answer. Communication and mutual respect are essential to navigating differences in desire. Many people also believe that you can tell if someone has had sex just by looking at them, or that there are physical signs of virginity, especially in women. This is completely false. There is no physical marker that can reliably indicate whether someone has had sex. The myth of the broken hymen as proof of sexual activity is particularly damaging and untrue. The hymen can be stretched or torn from a wide variety of activities, including sports, tampon use, or medical exams. It is not a reliable indicator of sexual experience. Another myth is that you can't get pregnant the first time you have sex, or that certain positions, douching, or other tricks can prevent pregnancy. In reality, pregnancy is possible anytime sperm meets egg, regardless of whether it's someone's first or 100th sexual experience. No sexual position or post-activity routine can prevent pregnancy. The only reliable ways to prevent pregnancy are consistent use of the contraception and practicing safe sex. Speaking of contraception, there's a persistent misconception that birth control pills protect against sexually transmitted infections, or STIs. While birth control pills are highly effective at preventing pregnancy when used correctly, they do not protect against STIs. The only forms of contraception that reduce the risk of STIs are barrier methods, such as condoms and dental dams. Combining methods, such as using condoms along with another form of birth control, offers the best protection for both pregnancy and STIs. It's also a myth that only promiscuous people catch STIs, or that certain kinds of people are safe. The truth is, anyone who is sexually active can contract an STI regardless of their number of partners, gender, or background. Some STIs can be transmitted even without penetrative sex, and some people may not show symptoms for months or even years, making regular testing crucial for sexually active individuals. There is no type of person who is immune to STIs. Another common belief is that sex becomes less important or enjoyable as people age. While it's true that physical and emotional changes can affect sexuality over time, many older adults enjoy fulfilling sex lives. Intimacy can evolve, and while it may not look the same as in youth, it can be just as meaningful, if not more so. Communication, patience, and adapting to changes are key. There's no expiration date on pleasure or connection. Some people also think that good sex means both partners climax at the same time, or that orgasm is the only marker of successful intimacy. In reality, sexual experiences are diverse. Not every encounter will end in orgasm, and that's okay. What matters most is enjoyment, connection, and mutual satisfaction. Focusing solely on climax can create pressure and anxiety, detracting from the overall experience. There's also the myth that your sexual orientation or preferences can be changed or fixed. Decades of scientific research and the consensus of major medical organizations affirm that sexual orientation is not a choice and cannot be altered through therapy or willpower. Efforts to change someone's sexual orientation, sometimes called conversion therapy, are not only ineffective but can be deeply harmful. Lastly, many people still believe that discussing boundaries or consent ruins the mood. In fact, clear communication about consent, desires, and boundaries is a cornerstone of healthy intimacy. Consent should never be assumed. It must be enthusiastic and ongoing. Far from ruining the moment, talking openly about what feels good, what's off limits, and checking in with your partner fosters trust, safety, and deeper connection. To sum up, sexual myths persist because they're often easier to believe than the sometimes complex and nuanced realities of human sexuality. They may be passed down through the culture, media, or lack of comprehensive education. But believing in these myths can lead to misunderstanding, shame, and even harm. It's essential to seek out accurate information, talk openly with partners, and approach the topic with curiosity and respect. Remember, sexuality is a natural part of life, and there's no normal that fits everyone. By challenging myths and embracing the facts, we can create a more informed, healthy, and supportive environment for ourselves and others. Whether you're exploring your own sexuality, supporting a partner, or raising the next generation, knowledge is the key to confidence and well-being. Let's continue to break down barriers, ask questions, and replace myths with facts, because everyone deserves to have the information they need to make choices that are right for them.